let's do a little pregnancy update and some lunch. So I had my 16-week appointment yesterday, you guys. I'm not checking my weight at this point, full transparency. I said my weight's not my business right now, unless they happen to make it my business, which I hope they don't. So as soon as I give birth, I'm going to have to make it my business, though. Unfortunately. The cravings, man. Oh, my gosh. Food addiction and pregnancy, they don't go together, okay? That's hard. At my appointment yesterday, they don't do ultrasounds. You have an ultrasound at like 9 weeks and then not again until your anatomy scan at 20 weeks. Like, I need to see my kid. I gotta make sure they're okay in there. That's stressful. But anyway, so I had bought myself a Doppler and my doctor warned me not to use one of those because if you don't know what you're doing, it's like really hard. So what I do, tried to use it. I couldn't find the heartbeat. I was in a panic all week. So I went to the doctor. She puts that Doppler on my stomach. 1 second, she found the heartbeat. Come on. I was thankful she found that, but so I'm going to have to lay off the Doppler, okay? Not to stress myself out. And then, you guys, it's not good. It's not good. What I'm about to tell you. I got the diabetes. I got the diabetes. I got the sugar. You got the sugar, like my grandma says. So, at my 12-week appointment, they wanted me to do, you guys know the drink they make you drink and they check your blood sugar every so often. They wanted me to do that. I'm a bariatric patient. I had weight loss surgery close to 4 years ago, and I can have dumping syndrome. It's very unpleasant, okay? And I told him, I was like, no, I don't drink sugar like that or eat sugar like that. I don't feel comfortable doing that. I'm not trying to end up in your ER feeling like I'm passing away or sitting in your bathroom all day. Okay, so what can we do? Doctor comes in, and I guess for people like their bariatric patients, they allow them to do 2 weeks worth of glucose testing. You have to do it fasting after breakfast, 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner. I had to track that for 2 weeks straight. I mean, my poor fingertips, man. And I did that, and everything was looking good until, like, it wasn't. I noticed my fastings, for some reason, were higher than what they were after dinner. They were above 100. And I thought, oh, it's what I'm eating, blah, blah, blah. So she looked at those, and she goes, you know, you're getting to the point, if you don't have the diabetes, it's developing. So she went ahead and prescribed me metformin. I'm going to start taking once a day, and then I'll have to switch to 2 times a day. She told me she would allow me to check my blood sugars a few more times, but she said if they're over 95 fasting or over 120 after eating, you've got to start taking that medicine. Y'all, this baby's going to be huge. I've always heard gestational diabetes, like when women have it, like they have bigger babies. Lord Jesus. Oh, so of course I'd get the diabetes, but apparently they had me checking everything at 12 weeks because I have a history of diabetes. I was on metformin from 8 years old, you guys. After I had my significant weight loss, that went away. But I had PCOS, insulin resistance, were more prone, they told me anyway, to develop gestational diabetes. So, not my first rodeo in the diabetes area. And she's like, we have a nutritionist. Would you like to see her? I go, no, I know what to do. Doesn't mean I want to do it. Because this kid likes carbs. So, anyway, I got the diabetes. So, I got to work on that. But cravings are hard. I mean, I told my husband this morning, I said, I need a salad with iceberg lettuce and shredded cheddar cheese. He's like, where from? And I said, I don't know. Who's got an iceberg salad with cheddar cheese and good ranch? So I'll be looking for that today. But that's the update so far. Is so good. I'm almost 17 weeks at this point, and I don't know when I'm going to post this. But I got the diabetes, y'all. If you have experience with it, let me know. Please tell me your baby wasn't like a 12-pounder, because people have been scared of me, okay? So y'all let me know.